Let's talk about opioid withdrawal and opioid overdose. Opioid withdrawal has an onset of a few hours after stopping things that are short acting like heroin, and then up to 3 to 5 days after stopping longer acting agents like methadone. Its duration can be between 3 and 14 days. It is usually non fatal. The signs and symptoms include piloerection, so that is the hair on your arm standing up, insomnia, lacrimation, diaphoresis, muscle aches, fevers, and diarrhea. Typically, what we give patients for opioid withdrawal is what's called a callus protocol. You guys can learn about that a little bit more in neuropsych, but it will be mostly management of the symptoms, such as giving like loperamide for the diarrhea. For opioid overdose, some of the big signs and symptoms are, and you can kind of think of these as like extreme versions of the side effects that we've already talked about, especially for acute use. So things like stupor or coma, that is obviously a severe side effect of sedation. Having low respiratory rate, we do know that it causes respiratory depression. Having pinpoint pupils, miosis at the most highest extent, cold and clammy skin, flaccid muscles, and hypotension. To reverse it, we use naloxone. Once again, that is a pure mu opioid receptor antagonist. Misspelled receptor. Wow, they're going to take away my license. And here's some ideas of some of the naloxone dosage forms. There is a thing called Revive training that you guys can get, and I think you guys might get it in your P3 year. You have the nasal sprays. There's the multi-step and the single step. You can see here that they are very easy to use. You have the intramuscular injection that's primarily used by EMS squads or an auto injector.